This is Health Tracks, and I'm Peter Graber. The State Public Health Directors Conference was held this week in Raleigh, and staff from the NCAFP was there, representing family medicine and the interest of family physicians who work in public health. The conference brings together both local and state public health leaders for strategic planning and to get an update on the progress that's being made as we work to improve public health in North Carolina. U.S. Surgeon General Dr. Regina Benjamin, a family physician from Alabama, gave the opening keynote address at the conference. Here's more on the conference and the brief interview I conducted with Surgeon General Benjamin on her national prevention strategy and the need to drive increased student interest in primary care. The 2012 State Health Directors Conference brought together public health officials from across North Carolina. A packed house at Raleigh's Crabtree Marriott was on hand to listen to U.S. Surgeon General Dr. Regina Benjamin outline the national prevention strategy, the federal government's plan for better health and wellness of all Americans.
I also believe that prevention is the key to building a stronger and more sustainable healthcare system. And prevention is not new to the national dialogue. However, in recent years, it's become more vital and relevant than ever before.
Dr. Benjamin described the prevention strategy as a plan that will help increase the number of Americans who are healthy at every stage of life, and one that should be woven into all aspects of our lives, including where we live, work, and even play. I caught up with Dr. Benjamin and asked how local family physicians can make an impact in their communities.
You highlighted the strategy, and a lot of it is about going into the communities to prevent chronic disease. As a family physician, what could you share with other family physicians across the state about how they can make an impact locally in their communities?
You know, as family physicians, we're a part of our community. That's what we do. I'm basically stressing the fact that health doesn't occur just in the doctor's office or just in the hospital. It also occurs in the community. It occurs where we work, where we play, where we pray. It works everywhere we are, and to get people to incorporate prevention into everything that they do. As family docs, we've been doing that anyway. We've been passing that message along. Now we want.
I also asked the Surgeon General for her thoughts on increasing student interest in primary care. She had this to share.
With healthcare reform rolling out in 2014, how do we get more medical students interested in primary care careers?
Well, you know, I'm biased because I think that's the best career there is, because you get to know your patients, you be a part of it. Bringing students into the practices like we do, we precept students. Oftentimes those students will see what we do as family physicians. Even if they don't become a family doc, they know what we as family physicians need when we send them to the specialties. So I think that being preceptors is an important part, but also encouraging students to understand that being a part of your community is a part of being part of your life. You know, it's often said we make a living by what we get, we make a life by what we give. Giving back to the community really is rewarding.
For NC Health Tracks, I'm Peter Graber.